Our next speaker is the Health Secretary. Susan Pearce is Secretary of New South Wales Health, appointed in March 2022, and is responsible for the management of New South Wales health system with over 120,000 FTEs and a budget of over $30 billion, and providing, as Jeffrey has commented on world-class patient-centred care. Prior to that, she had quite an easy role. She was just controller of the State Health Emergency Operations Centre. So Ms Pearce was responsible for directing and overseeing New South Wales Health operational response to the pandemic, and I personally thank you for that. From February 2021, she led the New South Wales Health vaccine rollout, establishing over 40 New South Wales Health vaccination clinics and more than 100 mobile outreach and pop-up locations across the state. So you see she had a fairly simple role for the last couple of years. She started her career as a registered nurse I won't say how long ago, in Broken Hill, and has also been New South Wales Chief Nurse. Please welcome Ms Susan Pearce, Secretary of New South Wales Health.
Thank you very much for that kind introduction. I'm about to tell you how long ago it was since I became a registered nurse, but can I commence by acknowledging the Darug community as the traditional owners of the land upon which Macquarie University is situated and where this event is obviously being held today, and I pay my deep respects to elders past, present and emerging. I'd also like to acknowledge those in attendance today. George, thank you very much. Joanna, of course, and really excited to hear more about the work that you've been doing. And Jeffrey, it's really good to see you all in person again. And of course, Cliff, an old friend of New South Wales Health, and it's lovely to see you this morning. I'm very enthusiastic about talking about a positive approach. I think after the few years that we've endured as a community, and certainly in the New South Wales health system, it's lovely to talk about positivity, because I think we all need a dose of that at the moment. What I wanted to do to start, before I get into some of the statistics and information about eMeds, and my colleague from eHealth, Mark, is here today, and I'm sure he'll talk more about that, so I'm not going to steal his thunder, is a story of my own from when I was a very young registered nurse. I started my working life in Broken Hill, and I spent 10 years working there. And I remember distinctly when I was thinking about this morning, I was thinking about medication administration, as you do as registered nurse. And it's probably something like, 2022? So it would be at least 30 years ago, maybe a little longer. And I was probably a new graduate registered nurse, actually, because I was working on the surgical ward in Broken Hill, but I actually ended up working in ICU for my clinical life out there. And I was pushing a medication trolley around, as you did in those days, to administer the medications to my patients that I had been allocated that morning. And I went into a 4-bed bay with the trolley, and we had a folder that, you know, the medication charts were all in this ring-bound folder, and you'd flip them over. And so I get to bed 4, and the patient in bed 4 must have been in the shower or something like that, and wasn't in the bed. And so I then went to bed 5 in the next 4-bed bay, but I failed to turn the page over. And so what I then did was I gave the patient in bed 5, bed 4's pills. And the point of this story is, I can tell you, after 30 years, I can still remember the feeling of that adrenaline rush and panic that you feel when you make an error as a clinician. It's just awful. And I looked at what I'd given. I'd actually given 2 antibiotics. So it's interesting, like, I can remember this with such clarity after all of these years, and the fact that I've now got dementia as a consequence of the pandemic and the trauma that I've endured for these last few years. I can remember it like it were yesterday, but I remember it was Fluclox and ampicillin that I'd given to this patient. And I thought, oh, thank God it's antibiotics, you know, it could have been worse. The problem was the patient was allergic to, of course, it would just be typical of my luck for that to happen. So, look, you know, I would like to also reassure you, in my view, was an excellent registered nurse. And that's not just self-praise. I have got some written documentation still at home somewhere to prove that. Look, as I say, the medication safety agenda is so important, and it's important for people who are proper practising clinicians, unlike me these days who trots around in a suit. The other point that I just picked up, Jeffrey, during your opening comments was the term prevention. And I think that we think a lot about prevention in the health system. Of course, it's incumbent upon us, preventing harm, preventing illness, preventing disease, etc. But of course, eHealth has a very significant role in prevention because of the story I just told you. You can see the correlation. I'm not going to show you a heap of slides because I'm scared of this clicker now, but you know, the one that I will put there for you is some, you know, pretty sobering statistics around what happens in respect of medication errors and the devastating impact that they can have on people and the community, and the cost associated with this. So look, I'm absolutely delighted to be here with you today to officially open the symposium, and of course the World Health Organisation's Patient Safety Day. The theme is medication safety, so perfect timing, Joanna. You certainly had a crystal ball. The fact that medication safety can impact on health outcomes, length of hospital stays. The hospital system, of course, as you read in the paper every day, is under enormous pressure, and I don't think that's about to change anytime soon. We've certainly got to change the way we do things, there's no doubt about that. So, you know, 230,000 admissions each year caused by patients taking too much or too little of a medicine, or taking the wrong medicine. And the cost, as I've already mentioned. So there's never been a more important time to tackle medication safety, and through research, innovation, technology, and patient collaboration. I think that's the other really important element of this. Patient collaboration is such a critical part of what we all do. So I know that you're going to hear, unfortunately I can't stay with you today. I've been in quite the flurry already this morning, and it's set to continue for the rest of the day. But I think you will all have the opportunity to discuss and hear insights from this world-first research achieved by some of the most talented minds right here in Sydney and in New South Wales, and led by Joanna and the Australian Institute. Here at Macquarie, the research is a partnership, as you would all be aware, with the NHMRC, Sydney Children's Hospitals Network and eHealth New South Wales. The electronic medication management system, and I'm sure, Mark, you'll be talking about all of this, will you? There's proven research out there that it certainly can lead to a reduction in impacts for medication errors, and of course for our little tiny paediatric patients who are certainly impacted by medication errors. And over the years, unfortunately, you do see those things come through where people have made, you know, seemingly very simple errors that can have very significant impacts. As Joanna's going to discuss with you, the research showed a considerable decrease in prescription errors due to the use of the electronic medication management systems at the children's hospitals, and it's a great illustration of two of the 6 core principles within our recently released Future Health Strategy. I'm going to give this button another go. I think I'm better at that button than you, Jeffrey. So look, safe care obviously goes without saying. We've recently released this strategy. It's on our website, of course, and what's contained within it won't surprise you. That, you know, our patients have a positive experience, that safety is paramount, that people are healthy and well, and of course our staff are engaged, and the research and our digital agenda and our sustainability agenda is not the topic I'm here to discuss today, but there's a lot going on in New South Wales Health. Harnessing digital technology to better deliver patient care is without a doubt. We've done a lot in New South Wales, and I think that we've got a lot to be proud of, that despite the challenges that we've endured over these last few years, we have kept going. And that's a great credit to our colleagues at eHealth. Certainly we needed them during that vaccine rollout, and I don't want to stray into COVID because it's actually nice to be talking about something not COVID related. But you might remember that there was meant to be a booking system for vaccines, and a certain government far away was going to deliver that. Well, of course, that never happened, and so our colleagues at eHealth all of a sudden became a creator of a vaccine booking system, and I'd like to acknowledge the wonderful work that they did there, but I'll get back on the topic. Look, we have a lot of collaboration across the health system. And I think that it's fair to say that the rollout of our electronic management of medications has been pretty successful over the last 4 to 5 years. It is a big change for practitioners to get used to using these mediums, especially some of them that are a little older perhaps, although I shouldn't be ageist. And I'm really pleased to report that eMeds is now in use in more than 200 hospitals across New South Wales, so I think that's a pretty solid achievement. Every single week, New South Wales Health clinicians open patient records almost 7 million times in our electronic medical record, and use the eMeds module to prescribe, dispense, administer medications to our patients on a daily basis. Of course, by removing paper, we're also helping the planet, but we've enabled the provision of consistently legible, complete and legal medication prescriptions. And it means safer patient care, but also significantly adds positive outcomes for patients who are receiving care in our statewide health system. The health and wellbeing of our smallest and most vulnerable patients has remained a key focus, and the paediatric requirements and design for eMeds was informed by the Children's Hospital at Westmead. We've extended the EMR across intensive care networks for our adult, neonatal, paediatric patients in the form of our electronic record for intensive care, and was the first a statewide ICU clinical information system had been deployed anywhere in Australia. It's also one of the largest in the world, operating in 24 hospitals and supporting 476 intensive care beds. So lots of training going on with that. When you do think, and it was really interesting again, Jeffrey, to look at your own statistics during the pandemic and how you kept things going here. Similarly, whilst we were dealing with the pandemic, we couldn't just grind our health system to a halt. The rest of it had to keep going. So not only has all of that work been happening, but to support the evolution of EMRs, we've gone a step further with the delivery of an electronic transfer of care system, which is designed to support safe, consistent transfers of clinical information between intensive care and general wards. This system supports staff and patients by reducing the chance of transcription errors, saving clinicians from manually switching between two clinical information systems, and keeping patient safety and medication management at the centre of everything that we're doing. A further innovation as part of New South Wales Health's progress was the recent introduction of fluid infusion management within the EMR. It's now used in over 180 facilities and can coincide with a significant reduction in medication and IV fluid clinical incidents. We've also started to look at our community-based services, and look, the list could go on and on. I guess the point of it is that in a very large and complex operating environment such as New South Wales Health, you've heard the numbers. We've actually got 160 or 170,000 headcount staff, so whilst it's 120,000 FTE, 160, 170,000 people is a lot of people to get on board with these types of programs. It is no small undertaking in a system of this size and complexity, but I can tell you that every single thing that happens in New South Wales Health every single day is about making our environment safer and better for our patients. I know that in some, sectors or parts of our system that there's a view that health system administrators are focused on the budget and KPIs. A couple of comments from me. As a person who was a Deputy Secretary responsible for all the KPIs across New South Wales Health, I can tell you the numbers are not the main game. It's what leads to them that is important. And we've done a lot of work over the years without ever focusing on a KPI. That's not our endeavour. Our endeavour is about safety, it's about improving the experience of our patients, and most importantly, improving the experience for our hard-working staff. We talk a lot about patient safety. My probably my parting message to you all would be that without the staff of our health systems across the state and beyond, nothing would happen. We need them, and I say this often when I'm out talking to groups of clinicians in particular. I need them far more than they need me. And the more we can do to look after them and to provide safe environments for our practitioners, the better. So look, I'm going to leave it there. As I said, I've been around in the health system for very many years. I'm very proud to be the secretary of this wonderful organisation called New South Wales Health. I hope that you have a very informative day, and I wish you well, and thank you very much for inviting me. Thanks, Charlie.